Welcome back to the NMC Specialty Hospital. We're back with the surgical insights, and today we have the opportunity to talk to Dr. Narendra, an orthopedic surgeon. So let's dive in. Doctor, how are you?
I'm doing great. Thank
It's
you.
a pleasure to have you.
Pleasure here.
Let's talk about what got you inspired into orthopedics.
Well, orthopedics is a practical subject. You know what I mean? If you see medical branches, they speak more, they do less. Whereas we speak less and we do more.
Yes.
So we live on the tagline, life is movement, movement is life.
Oh, yeah. Very
So we put the patients back on their feet so that
Literally.
they can live active lifestyles.
Amazing, perfect. So let's talk about these patients and let's talk about Dubai lifestyle and all of that.
Yeah.
How is Dubai active lifestyle and hot climate affects the type of injuries you see?
All right. So if you see, Dubai is usually warm and humid.
Mm-hmm.
So what it leads to is a lot of perspiration when you get into active sports,
Correct.
especially the outdoor ones. So this leads to dehydration.
Mm-hmm.
So dehydration is one of the main causes of injuries. So
Okay.
if the muscles have to remain active, which are the secondary protectors of the joint or the bones. So if they're not active, they get active only when they're hydrated well. So dehydration is one of the important factors to be considered. So that leads to muscle injuries, joint injuries, these are the main things.
This is very interesting because as a sports practice, I always think water hydration just for hydration so you don't faint.
Yeah.
But we're talking that goes deeper. Like your bones actually need the water as well.
Yes, if you know 70% of our body is water.
Correct?
Yes, so water is very, very important as far as even for sports enthusiasts or anybody for that matter. Even a normal person to carry out day-to-day activities, water is very, very important. At least on an average, you need to consume at least 8 glasses or 2 to 2.5 liters per day.
Correct.
Yeah.
Okay, perfect. So definitely those lack of dehydration cause a lot of injuries.
Yes.
Is there any more common, like broken feet, broken arms? Is there any more common than?
It's quite common with this so-called weekend players and this thing.
The weekend warrior.
The weekend warrior.
Let's talk about them.
Yeah.
Okay,
Yeah.
perfect.
So if you know Dubai well, most of them are office goers or they'll be working somewhere, and then at the end of the week, either they really get active.
They want to give it all.
They want to give it
Okay.
up. So they come and play the sports without warming up, without getting hydrated well. So just get into the sports, especially the demanding sports like football or cricket, or sometimes even sprinting or whatever you want to do. Even just going for a long jogs, you need to do a lot of warm-ups before that, and you need to get hydrated well. Otherwise, they get into common injuries. In fact, most of the patients I see with joint injuries or muscle strains are these weekend warriors.
Weekend warriors.
Yeah,
Okay, so
yeah.
good advice for the weekend warriors. And again, are those people
Yeah.
who don't do much during the week, and on the weekend they have all the energy in the world. So hydration, warming up is
Yes.
definitely key.
Yeah.
Okay, now let's talk about the people who work more in the desk, right? And maybe these weekend warriors are the same.
Yeah.
That they get a lot of neck pains, back pains.
Yeah.
How do we know it's just a bad posture that you can adjust, or it's actually a condition that you need to come and see in a specialty?
All right. See, normally those who sit for long hours, they're prone for back pains mainly. Okay, if they don't sit well, basically, you need to sit well. Work ergonomics, so-called work ergonomics, are very important. So see that your lower back is always supported while sitting, and sit upright, always 90 degrees, and feet on the ground all the time. Okay, so avoid poor postures. So these usually give rise to pains and aches if you don't take care of the postures, but if it lasts for a longer duration of time.
Okay.
So let's say more than a week or 10 days, still keeps nagging you, and you feel some pins and needles in your feet, or if it's a neck, if you feel some pins and needles in your hand. So these are the warning signs. You need to come and see the doctor. Or if the pain doesn't go with basic home remedies like popping in some Tylenol or Panadol tablets, still pain persists, please go ahead and see orthopedic surgeon.
Amazing. Okay, perfect, doctor. So now let's talk about the knees and hips pains and joints that is a widespread thing here in the UAE.
Yeah.
Is there something that the local population can do to prevent those kind of injuries, or maybe take better health, better care of the bone health?
Yeah. See, prevention is always better than cure. So always those who are into sports, I advise them to take care of their joints.
Okay.
So how do they take care? Whenever they want to get into sports, again, I repeat, hydration is very important. Stay well hydrated. Secondly, do a lot of warming up, stretching before you, at least 15 to 20 minutes minimum,
Okay.
before you get into any physical activity. So this will be ideal. So these two things they have to take care of.
Okay, perfect. Amazing. So we know definitely prevention is key.
Yeah.
But unfortunately, even sometimes when you prevent, surgery is needed.
Yeah.
So let's talk about the advancements in surgery in orthopedics. Because like we were talking about earlier, before if someone had a broken foot, a broken arm, if the cast, you can barely move and everything like that. Now, the technology has changed that.
Absolutely. Yeah.
Tell us about how this technology has improved the surgeries to make it easier and also to make patients recover faster.
Yeah. See, implants, when I started my career way back in 1995, the technology was not so great. We had basic implants available those days, one size made to fit all, that kind of a thing. Now we have, pre-contoured plates, we have developments in terms of metals used in the implants as well. You have moved from basic stainless steel to titanium, all those things. We have developed minimally invasive techniques, especially when it comes to treatment of fractures, what is called as MIPO, or minimally invasive plate osteosynthesis.
Okay.
Where we make in small incisions, drive the plate under X-ray controls and fix the fractures so that, patient can be up and out very fast.
That's amazing. So let me see if I can get this straight. So before, let's say a patient will come with a broken foot and they need the implants and things like that.
Yeah.
Before it had to be like a big incision in order to be able to. Now with a small incision, you can do all of that.
Yes.
Is there anything more in the future that you foresee regarding the technology, like 3D printing, AI, that can still continue into the orthopedic surgery?
Definitely, it's already there. In fact, the 3D printing and the AI, the robotics is evolving, and it's evolving very fast. That has played a very important role, especially when it comes to tumor surgeries or trauma surgeries or joint replacement surgeries. These play a big role nowadays.
Okay.
So when it comes to tumor surgeries, 3D printing, sometimes the tumor surgeries, those who are undertaking this musculoskeletal tumors, sometimes they need to replace the whole bone. So 3D printed models, they play a big role nowadays.
Amazing.
Yeah.
Thank God for technology.
Similarly, in case of joint replacements, you can have patient-specific implants.
Okay.
So you can build them as the patient needs.
Perfect.
Yeah. So again, they can be 3D printed. You can go down to the wire, exact fit for the patient. Otherwise, until now, what we have is again various sizes.
And you try the better fit.
You try the better fit on the table.
Yeah.
And with the robotics, you can even go down to up to a millimeter corrections. So
yeah, very
it's
amazing.
Not that far. Yeah.
Perfect.
Yeah.
So going back to the back pain,
Yeah.
and actually I'm going to speak here personally with family because my father suffers from a lot of back pain, and they have telling him about a lot of surgical options, but he's still afraid of them.
Okay.
Let's talk about those patients who are maybe a little bit afraid of the orthopedic surgeries because they believe the recovery time is quite long or because they believe it's quite dangerous. Tell us what you think about this, doctor.
Well, as far as the back is concerned, more conservative, more better it is.
Okay.
So try to conserve as much as possible. If the patients do not respond to conservative treatment, and if there are specific indications like sudden onset of neurodeficit, or patients not responding to basic treatments like medications, physiotherapy, in such cases, or neurological symptoms like pain along the leg, now worsening, not able to carry out day-to-day activity, that's the time the surgery is indicated. There are various causes for surgical treatment. Like for example, a disc prolapse, major one causing severe pain along the leg, not responding again to conservative treatment like physiotherapy, medications. So if they don't respond, our next step is to give injections. If still doesn't respond, then proceed with the surgery. And when it comes to surgery, as far as the back is concerned, again, there are a lot of technological advances. People are doing through scopy nowadays. Just one small minor incision, just 1 centimeter, and then they go in and take out the offending disc and then come out. Patients are up and out within a week's time. Whereas olden days, we had to make a big incision, go down, dissect the muscles, remove the disc. It was quite a major amount. Nowadays, they can get back faster. So no need to be afraid of those things.
I was going to say, so would you agree, doctor, that now orthopedic surgery has become something a little bit, not easier, but definitely a little bit less invasive, less harmful and less hurtful?
Absolutely.
So when do you think it's time for a person, let's say they have a pain in their joints or anything, they usually, like you say, they take medication, maybe it doesn't go away. So they go to maybe just a general doctor, and the doctor again go and take more medication, do a little bit of physiotherapy. When do you think, okay, it's definitely you're waiting too long to come to me? When do you say, okay, come and see a specialist?
While on treatment, if they develop worsening of the pain, number one. Number two, if they develop any neurological deficit.
Okay.
Like not able to pass urine, sometimes retention of urine, or sometimes the feeling numbness on your feet.
Okay.
Sometimes you may feel your foot is weaker, not able to wear your footwear properly, or slipping of the footwear. So these are the indications that you're developing a neurodeficit.
Okay.
So that's an indication for
to go and see a specialist like you.
Exactly, yes.
Okay, amazing, doctor, perfect. Okay, so we talk about lifestyle, we talk about the weekend warriors, we talk about, how people can, get better. Is there any last advice that you want to tell people and how they take care of their joint and bone health?
Well, as far as the bone and joint health is concerned, bone basically gets nutrients from the blood. So it's important that you stay hydrated and active.
Okay.
So active lifestyle is very important. At least 20 minutes of walk if you can't do much of it.
Agree.
So that's what I agree. That's what I advise my patients. At least 20 minutes of walk. Brisk walks will definitely help. That'll, give a lot of blood to the bone, being your muscles staying active. So that's where the bone derives its nutrients from.
Okay.
So when it comes to the joint, you need to keep your joints active. So you need to have specific joint activities, either by stretching or, doing cycling. Cycling is a very good form of exercise, especially for the knees, okay?
Yeah.
And the hips as well, because it's non-weight bearing. At the same time, it will keep the joint in motion. This will allow the synovial fluid to circulate in your joint.
Okay.
So,
perfect.
So these are the things. And then hydration is very important. Same time is the diet, equally important. High protein and diet in moderation, vegetables, fruits. So these are very, very important, play an important role in keeping the bone and joint health.
Correct. I agree with you 100%.
Yeah.
Okay, doctor, now we want to get to know you better. So we're going to go what we call rapid questions. Okay? I'm going to fire questions.
All right.
And then you're going to answer the first thing comes to your mind.
Sure.
Okay? There's no letter wrong answer. Are you ready?
I'm ready, yes.
Perfect.
Yeah.
One orthopedic tool that you cannot live without.
Drill.
Okay.
Okay.
Perfect.
Yeah.
What is your favorite minimal invasive technique or instrument?
Arthroscopic surgery.
Okay.
Yeah.
Very good.
Yeah.
High heels, fashion statement or orthopedic nightmare?
Orthopedic nightmare.
I'm sorry, doctor. I'm sure I cannot live without them. Okay. Ice or heat for a fresh sprain? Like with someone injures right away, so being on a heat.
Ice.
Thank you.
Yeah.
Perfect, doctor. Coffee, tea, or water? What's best for your bone health?
Water.
Perfect.
Yeah.
One quick daily tip for stronger bones and joints?
Good hydration and diet.
Perfect.
Yeah.
The most unusual fracture you have seen?
Well, it was a freaky injury. Once patient was playing tennis and suddenly jumped. That's it. And she came with a dislocated joint on the ankle.
Just for a little job.
And the skin was cleanly cut. Yeah. And it was deep down into the joint.
Oh, yeah.
That was the most freaky injury I've seen here.
Yeah,
in Dubai.
crazy. Okay. What is the most rewarding surgery to perform because of the immediate impact?
Arthroscopic surgery.
Okay, which one is that one?
Can I?
Yeah, like the most rewarding surgery to perform because of the immediate impact.
Immediate impact.
Yeah.
All right.
Maybe
it comes to.
Like if you do a back pain surgery, the pain is almost gone right away, right?
That's true. That's true.
Okay.
Especially if the patient has a limb pain,
Yeah.
radicular pain. After you remove the disc, the pain is immediately gone.
Yeah, imagine. That would be, I'm sure, very rewarding for you and the patient.
Yeah.
What is your number one tip to avoid sports injuries? You have mentioned this a few times.
Yeah. I think I'm going to repeat this again. Hydration and warming up.
Correct. The best way to stay fit in Dubai, do you think will be a gym or outdoor sports?
Indoor is better during summers. Otherwise, I would advise outdoors.
Okay, yes, outdoors, right? It's at least more fun.
Yeah.
Okay, what is a non-medical hobby that you enjoy for yourself?
Listening to music.
Oh, very nice. What kind of music?
I listen to various kinds of music.
Very good.
Yeah.
Very good.
Yeah.
One word to describe the future of orthopedics.
Robotic surgeries and AI.
Perfect.
It's coming up in a big way. Yeah.
And last but not least, a red flag in a limb pain that needs urgent attention.
Red flag
In a limb. I think you mentioned this, like when there's numbness, right?
when there is numbness and when the pain is increasing. Yes.
Amazing,
Yeah.
perfect.
Yeah.
Well, doctor, what a pleasure getting to know you.
Same here.
Let's hope all those weekend warriors listen to your advice
Okay.
and they do a more, ongoing warm up and a lot of hydration.
Sure.
Perfect. Thank you, doctor.
Thank you.